Good afternoon to all. I'd like to greet Ambassador Rui Pereira from the Brazilian Cooperation Agency, Dr. Socorro Gross, representative of PAHO and WHO in Brazil, Ms. Cristina Buquerque, which is coordinator and representative of the UNICEF in Brazil, and Nízia Trindade, president of the Oswaldo Cruz Foundation, and João Aprígio, of the coordinator of the Human Milk Bank Network in Brazil. My friends, this is an important day, and the Ministry of Health of Brazil supports this initiative in a very determined way. Breastfeeding in itself is already an act of love. The donation of that breast milk is twice as much an act of love. So to all mothers that donate their milk to help those kids that need it the most, my greeting, my recognition, and in name of the Ministry of Health, it is necessary that all of us are united. Besides recognizing this initiative, that we stimulate that it be even more amplified. It is fundamental for the health of our kids, and those that invest in kids invest in the future. There's no doubt about it. That's why the Ministry of Health, and I ask for your attention for a video of our campaign that gives incentive to the act of sharing human milk. Open letter from a mother to a mother. To be the mother of a baby is to know unconditional love, to know a new level of wariness, but also of affection, is to smile together, cry together, and take naps together, to feed, care, worry, to become an emotional once more, even during the pandemic, to help other mothers with premature babies and that needs that mother's milk. So this thanking in the form of a letter is for you, you who donates hope, a great gesture that can save the life of those that need it the most. If you can donate mothers, if you can donate breast milk, do it. Any quantity can make a difference. May is the month of the mothers, and mothers are synonymous of breastfeeding and of love. And this day is the National and World Day of Human Milk Donation. Brazil, as we've mentioned various times, is international reference, and has one of the greatest networks of world. We want to increase these initiatives. 222 HMBs all over our states, and 220 collection points all over the country. The numbers of donation is still very low as regards to our demand. That's why in days like this, it's very important to us. From January to December 2020, 290,000 liters of human milk were collected. 182,000 women donated human milk. To those women, our thanks. 157,000 liters of milk were distributed. 212 newborns were benefited. This represents 64% of the real need for human milk in Brazil. When compared, the volume as compared 2020 compared to 2019 show a 2.7% increase of donation. So even during a health emergency of international level, this pandemic of the COVID, we had 2.7% increase in donations, but it is necessary to advance even more. The pandemic demands that many efforts be done for qualified information as regards the security of milk donations. We've worked day and night to overcome this health crisis, and the proof of this is that we are among the 4 countries that have most distributed vaccines to its population. 90 million doses of vaccine have been distributed since the beginning of our campaign. And we have 2 national institutions that are public institutions, Fiocruz and the Butantan, that have the capability of producing these vaccines and the main suppliers of vaccines for the national program of immunization. And Oswaldo Cruz, his foundation, in the beginning of this semester, has the capability of producing vaccines with inputs that are totally national. But it is a commitment with health, but especially with women, in pregnant women. We know that vaccines, the Ministry of Health, in partnership with the CONAIS and CONASEM, we understood that this was a strategic point, this vaccination of pregnant women, and we will make an effort so that more than 3 million pregnant women, especially those that have have health problems, that they might be benefited with vaccines. And these will be the women who will be breastfeeding their kids and will be donating milk to our milk banks, and in that way helping children that are hospitalized in ICUs, in neonatal ICUs, and to help their recovery. To stimulate this donation and to the benefit of these premature babies or of low-weight babies and those that are in intensive care units, they cannot be fed by their mother, the Ministry of Health launches the national campaign of breast milk donation with the slogan, "Donate breast milk, donate hope," a great gesture that can save the life of those that need it the most. I'd like to thank Mr. Antonio Rodrigues Braga Neto and our Secretary of Primary Care, Dr. Rafael Câmara de Medeiros. And I thank you for the support that you've been giving to this initiative, be in Brazil, be to the various countries in the world. Thank you very much.